Hi, my name is Amari Salman. I'm going to be recording the insertion of a Foley catheter on a female video today for Nightingale College. My tools today consist of my Nightingale uniform, badge, my Foley catheter kit, my patient hand sanitizer for hand hygiene, my washcloths, and my gloves. So I'm going to start off by entering the room, ensuring patient privacy, introducing myself, verifying the patient's name and date of birth against their wristband, and explaining the procedure. Okay, so I've entered the patient's room. I've ensured patient privacy by closing the door behind me. Hi, my name is Amaris. I'm going to be your nurse today. Can I please have you verify your name and your date of birth? Okay, so their name and date of birth did match with their wristband. So today I am going to insert a Foley catheter per your provider's orders. This procedure should take about 5 to 10 minutes. Do you have any questions or concerns? Patient has no questions or concerns. Okay, do I have permission to expose you and to touch you? Perfect, the patient has given me permission to expose her and touch her. So I will be performing hand hygiene. And now I am going to place my gloves on. Okay, so I am going to expose my patient. And I have my 3 washcloths here to wash the patient up. So my first washcloth has warm water and soap on it. I am going to use one corner for the outer labia, the second corner for the labia closest to me, and then the third corner to clean the middle. So I'm going to start cleaning the perineal area from top to bottom. I'm going to change corners and clean the one closest to me. And now I'm going to use the last corner to clean the center. And while now I'm going to use my second washcloth that has only warm water to rinse her off. So I am going to clean the labia farthest from me. Use the second corner to clean the labia closest to me, and use the third corner to clean the center. And now with my third washcloth, this one is dry, so we're going to pat her dry. One corner, second corner we're using this one for the one closest to me, and again the last corner for the center. Now we're going to inspect her to ensure she has no any changes to her skin integrity, no discharge, no odor, and then I am going to find her urinary meatus. Okay, so now that she's all clean, I am going to let her know that I'm now going to set up my Foley catheter kit. This is a sterile procedure, so I'll just have you stay up very still and make sure you don't touch any of the supplies so that we don't break sterility. I'm going to perform hand hygiene. Okay, so I'm going to remove my kit and the bag. I'm going to open this from the farthest one out, sides. I'm going to remove my sterile gloves. Open this using only the 1-inch margin. Using my non-dominant hand, I am going to grab the cuff, place my hand side, making sure that the cuff stays around my wrist. Now using my 4 fingers, I'm going to grab the inside, and I will place my glove on the other hand here. Okay, so now I'm going to touch this from the inside, throw it out. I'm going to grab my cover here and place this below the patient I'm gonna have her make sure her knees are bent and her legs are open. So I'm gonna finish grabbing my supplies. I'm going to place this drape over the patient. Okay, I'm going to grab my 3 alcohol swabs. Open these up. Place them in my bin here. Throw that out. Now I'm going to, again, clean the patient with these alcohol swabs, making sure I clean from the farthest labia, from top to bottom. Throwing that out. Closest one to me from top to bottom. And now the center. Okay. So now I am going to grab my catheter, and the tubing will go into the opened, into the lube. Okay, so now I am going to connect my needle onto the tubing here. Okay, so I am going to inform the patient you may have some discomfort, but it should only be temporary. I'm going to grab the tubing. I'm going to place this 3 to 4 inches inside of the patient. And now that we see urine, I'm going to push another 1 to 2 inches in. Then I am going to add the 10 milliliters of the saline. Okay, so now I'm gonna move this. I am going to pull to make sure there's some tension there. And now that that's placed in, I'm going to connect this near the patient and then hang this onto the patient's mattress. And once that's connected there, I'm going to clean up the patient. I'm going to throw away my supplies. Did you have any questions or concerns for me? No? So, excuse me, sorry. I'm going to remove my gloves, perform hand hygiene. Okay, I am going to document the procedure, inform the provider of any concerns, and thank you for allowing me to insert this Foley catheter.